Good day, everyone. I am your teacher for today, and you can call me Sir Ken. So, in our subject, Physical Education and Health, we're going to be tackled about our lesson, Sexually Transmitted Infection and Their Prevention. So, for our first activity, we're going to play 4 picks 1 word, and I will show you the two features. You can and you answer in 3 seconds, and this the feature. This the first picture, and you answer it in 3 seconds. Correct. The answer is consult. So the next picture is correct. The answer is prevention. So thank you for participate for our first activity. So let's go on in the next activity. So the next activity is the activity one is watch and learn. I will post video presentation, and
Chlamydia is
you
a bacterial
will
infection
you
that's
will watch
primarily
and
sexually
analyze the
transmitted.
video and
Most
answer
folks
the
who have
following
chlamydia actually
question
don't have any
later.
symptoms,
So
but it
let's
can
go.
cause a lot of inflammation that can be uncomfortable and can also be associated with infertility. Symptoms associated with chlamydia include urethritis, so pain with urination in both men and women. In men, it can also be associated with epididymitis, so a painful swelling of the scrotum. Most of the time, women are asymptomatic, but can also be associated with vaginal discharge and pain with urination. Usually, when someone comes in and we make the diagnosis of chlamydia, the treatment regimen is a single pill, sometimes associated with a single injection that we can also give in the clinic.
So let's move on the lesson objectives. The first one is to learn STI how STI are being transmitted, to identify sign and symptoms of STIs. The third one is to determine the risk of SDT transmission throughout sexual activity. And the next one is students should be able to explain how the spread of STT can be reduced or pretended. STI can have a range of symptoms include no symptoms. That's why sexual transmitted infection may go unnoticed until a person has complication or a partner is diagnosed. So let's move on causes of STI. Sexually transmitted infection can be caused by, so first one is bacteria, including chlamydia, gonorrhea, and syphilis. Parasites such as Trichomonas vaginalis, or insects such as crab lice or scabies mites. Viruses including HIV, AIDS, herpes simplex virus, human papillomavirus, hepatitis B virus, cytomegalovirus or CMV, and Hika. So let's move on prevention. Uh, there are many ways to avoid or lower your risk of getting an STD. So first one is avoid sex or sexual activity. Stay with one unaffected partner. Wait and test. Get vaccinated. Use condom and dental dams consistently and correctly. And and the next one is don't drink alcohol excessively or use illegal drugs. And next is talk to your partner, and the last one is think about male circumcision. We have an activity, so create your group with 4 members and share your thoughts about our topic we tackle. So I will give you 10 minutes to answer and share your thoughts about our topic or our lesson. So I will time I will give you time and think, share your thoughts about our lesson or topic earlier. So thank you for your participate, and your all of your answer is correct, and all of your thoughts it's correct. Thank you for sharing about the idea and about the learning that you have in our lesson. So thank you class, and let's move on the post test. This only five question, and the five question it's all about the true or false. So I will give you three minutes, or I will give you 3 minutes to answer this post test, because you have a learning about the essence of our five questions, and you can check your own paper. So this is the answer. So class, I want to give you some assignment. This is so very easy, and the assignment is make a slogan about pretending sexually transmitted infection. This is the criteria of our assignment. Relevance to the topic 25%, creativity 25%, originality 50%. So the total is 100%. You can submit it in next week. So we will meet next week. So thank you guys for listening, and thank you for listening and participate in our class. Thank you for all.